This is One on One. We're pleased to be joined by Dave Ellis, Global Conversation Catalyst and founder of Dave Ellis Consulting. Good to see you.
It's good to see you also.
This is a very important study, the study around adverse childhood experiences. That study told us what about the experiences of certain children and the impact it has on their development, on their lives. What are we talking about?
Well, we're talking about anything from domestic violence in the home. The original 10 were around 5 types of household dysfunction, 3 types of abuse, 2 types of neglect. We know now that there are even more. So we're talking about things like homelessness, food insecurities, bullying, those types of things. And to be really clear, lots of folks ask the question about poverty, and is poverty an adverse childhood experience? The research says it's not, that poverty in and of itself is not an adverse childhood experience.
But excuse me, but if poverty causes food insecurity,
it's the food insecurity that causes the problem, right? So what we're talking about is that being poor in and of itself, it will exacerbate not having enough food, but just being poor. I grew up dirt poor.
tell folks, you were telling me before we got on the air here in Atlantic City, you grew up in a fascinating place. Talk about it. Where was it?
Yeah, I grew up on the Illinois-Kentucky border, a little town called Shawneetown. It is the farthest point north that slavery existed in this country. And so it sits right on the Mason-Dixon line. When I go home, I feel like I'm in the deep south. And so yeah, I have an entire history of those types of things and growing up extremely poor in rural America.
But adverse childhood experiences, you understand it not just from an intellectual point of view, from a point of view based on studies, you understand on a personal level.
Very much so.
Talk about that.
One of the things that we know through research and just through general experience is that unless we start to do our own work, all of us are carrying something. You can't grow up in this country and not carry some type of trauma, some implication of it. And unless we're willing to talk about that and to work through that, we get hung up trying to help people when we haven't even done our own work. And it's really hard to do because our stuff gets in the way. For me, it wasn't until I was 60 that I found this study, right? And so I've spent the last few years, I'm not going to tell you exactly how old I am, but the last several years working specifically to move this information from a research platform into the community so that the people who are most impacted get the same information that the professionals get. We train professionals all the time.
Which is why you're here presenting.
That's right.
To these educators. To do what for our children?
Not just the children, families, and communities. We always want to talk about kids as a singularity. Kids don't exist outside of the context of family and community. So if we're going to talk about them, let's talk about them in that context. I'm here to give people an opportunity to begin to explore, to hear what does the research say, and then explore where am I in my own journey. It's not about how can I do all these things out here. It's about how can I focus in here, help deal with my own stuff
As
so
an
that I am
educator?
better. Yes, so that I am better prepared to deal with those kids coming in.
You're asking educators to go deeper inside and examine their own childhood experiences?
Yes, I am. So part of my role here is to provide the training and to give people an opportunity, because I think most people want someone from the outside to come in and give them answers. And that's the way we've always done this, right? So
That's
come in
not
and
your
tell me
thing.
what to do. No, that's not my thing. My thing is to come in and let's talk about who knows the kids in New Jersey better than anyone else.
These
People
teachers.
right here in New Jersey.
That's right.
And so the answers are sitting right here. I'm the guy that helps bring out a way
That's right.
for people to have the dialogue.
We're involved in an initiative called Right from the Start NJEA. The website will come up as I'm mentioning it. Birth to 3. How critical?
Absolutely critical. 85% of all brain development happens prenatal to 3. So if you stop and think about that, when children are born, you've got nature and nurture, right? So they have everything they need right from the very beginning. 4 things, basically. Eat, sleep, poop, cry. That's what they do. Everything else from then on is an experience. And so there's an overwhelming amount of experience that comes in. The things that they experience the most is what gets hardwired into the brain. Now, I did not say good or bad. I said what gets experienced the most is what gets hardwired in the brain,
Whatever that is.
whatever that is.
I want to thank you for joining us here in New Jersey, here in Atlantic City.
Thank you for asking me to be here, sir.
Our pleasure.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating over 30 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Wells Fargo, New Jersey Sharing Network, RWJ Barnabas Health, the Turl Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, Caldwell University, and by Choose New Jersey. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area.